All right, happy Saturday. I'm going to do a weekly recap of the important things that published this week in research that is related and important and relevant to the HIE community. We're going to lead it off with something super fun to talk about, HIE and COVID. Before 2020, SARS-CoV-2 was not a virus that was widespread in the world. We don't know, obviously, everyone can debate the origins of that. But we're here to talk about the impact, and we know that the data has shown that HIE in utero, intermittent chronic HIE is happening in many sick pregnant mothers, and we have those families that join our community, and it's now well researched. And one of the questions always is, what are the neonatal outcomes when we talk about safety of vaccines and impact of vaccines and things like that and the risk benefit. So this just published this week, and why it's relevant to us is because it focuses on neonatal outcomes after a COVID vaccination and pregnancy. This is a humongous cohort studied. So they looked at 95,000 babies that were exposed to mRNA vaccines in the womb, and then they compared the group to 100,000 mother-baby dyads who were unvaccinated. This new research specifically calls out neonatal adverse outcomes, and they analyze by morbidity, so brain bleeds, circulatory, neuro effects, GI, pulmonary, and then mortality, death. So the prevalence of HIE was 40% greater in the unvaccinated mother-baby dyads than it was in the vaccinated population. And this prevalence was also statistically significant in the numbers of stillbirth, numbers of prematurity, numbers of brain bleeds that were associated, so interventricular hemorrhage, IVH, and other such brain bleeds. And so this is really important information as our families go to make informed decisions about prenatal care for any subsequent pregnancies, and looking to analyze risk factors for developing HIE in different ways. Then unfortunately there's so many ways, and this was another one added on, that HIE can happen. So this is really, I think, important information for people to weigh and understand and make informed decisions around. All right, next up, we have some new research about diagnosing HIE. All right, researchers from the Imperial College of London published this important research this week in JAMA Network Open that analyzes gene expression and isolates potential of unlocking why some babies may benefit from hypothermia and some may not with HIE. So in this research, they looked at patterns of gene expression, and that expression can change over time. It's not the same as having a specific identified genetic diagnosis. It's that genes express themselves differently during, different illnesses and acute events and injury and things like that. And so they took data from the HELIX study, which looked at cooling in low and middle income countries in India, Sri Lanka, and another country I got to look up. But they found out of that study that cooling was actually negative. Like it had worse outcomes, and they had more infant mortality and morbidity with that. So they wanted to know why. So they did all of this gene expression work, which is highly technical. It is not the same, again, as getting a whole genome sequence done and having an identified, duplication or deletion in your genetic material. This is how your genes are, expressing themselves during illness. But the genetic advancement that we are seeing, it allows us to see this work being done. And so what they found is they found a distinct difference in gene expression pattern in babies that experience that intermittent chronic HIE in utero brought on by multiple chronic stresses versus those with an acute HIE event around birth. And babies with the chronic HIE, like I said, did worse in the HELIX study. They found that, most did not benefit from the therapeutic hypothermia. And so what this allows is for a next step to see if we can develop a simple, fast blood test done at birth to better identify HIE and see which babies specifically would have an opportunity to benefit from cooling and those that they wouldn't. And that can also lead to more scientific advancement for targeted therapeutics for HIE, which is a good thing. All right, and last up for the research before I talk about a research project is on preventing HIE. And so another big it's a pre-proof, so there's still some editing, I'm sure, that has to go into it. But the American Journal of Gynecology published a study out of Finland that analyzes over 200,000 spontaneous full-term births in maternity hospitals between 2005 and 2023. It looked at tracings of mothers and babies during labor, and that this is not going to surprise many of us that are in the HIE community, but because we've heard this time and time again, that unfortunately there are some causes of HIE where when they were looking at fetal heart tracings, they were actually tracing the mother's heart rate and not the baby's. So this shows that if you have any sort of, you need to do dual monitoring, so you need to have the tracings, but you need to also track maternal pulse. And or have an actual monitor on the fetal scalp inside before the baby comes out. Doing this, if you didn't do that and you just had external fetal heart rating monitoring alone, it had a 1.6-fold in risk of HIE and a 2.3-fold risk of severe umbilical cord blood acidemia, which can lead to HIE. So this is really important, I think, as we look at improving standard of care. And again, families making decisions of what monitoring that they will push for. If you are interested in looking it up, it is in AJOG again, and it is intrapartum cardiotocography with simultaneous maternal heart rate registration improves neonatal outcome. There you go. Last but not least, we have community-driven research happening, and we have the absolutely wonderful Dr. Matt Mara, who is a dentist. He is a researcher in HIE dad and a professor at Boston University's dental school, and he also has his own dental practice. His background is in research surrounding dental disparities for the HIV population, and he is bringing his research prowess and interests to actually put together a needs assessment survey and a baseline of where the gap areas and barriers are for our community in oral health. And so if you have some time, which we would love, this takes about 5 minutes, you can go to tinyurl.com/HIE oral health survey. And it's a 5-minute survey. It talks about your experiences. There's demographic information. In case you're wondering why they ask how far you are from different things, it's because we want to see, like, is there potentially an issue of accessing care if you live 2 hours from a dentist and things like that. And this is also something that we've been focusing on because it is Children's Dental Health Month. We did a Q&A with Matt on Friday talking about the study, talking about research and impacts of dental care or lack thereof, or on, oral health with HIE and those connections, including enamel hypoplasia, including, dry mouth and things that can happen, medication impacts, all of that. And then he also did in our peer perspective series with Haley Thomas, our social worker. He and Don Hamilton, a longstanding HIE parent who has been a trailblazer for so many people, discussed their experiences of getting dental care. Don in particular, sought orthodontic care, which I think blew a bunch of people's minds because her daughter's more medically complex. And she was like, well, why shouldn't she have the same access to orthodontic care as anyone else? And I think that is a wonderful call to action that can empower our families to look at how they can get equitable care for, their kids and our kids. So again, feel free to take that, please. We've had over 100 respondents already, and we'd love to have more. Thanks so much, and I hope this has been helpful.